Hello everyone, it's me Albert, and here we are with my Medicare series, Aprendiendo con Alberto, Learning with Albert. And so I am going over the Medicare and You book, and in today's topic, I am going over what is a Medicare Advantage plan. What types of plans are there? That is a topic I'm going over today. Remember, you can reach me at any time at 956-622-8740 in case you have any questions. In my previous videos, I went over costs. I went over deductibles. I've gone over what benefits it covers. Lots of different things. Remember, if you're watching this series and you learn something, share. Why? As I say it to my little kid, sharing is caring. So I say that to my 6-year-old all the time. Sharing is caring. We care about our neighbors. We love our friends. Please share this information with the public. Why? Because I'm hoping to make a difference for you and simplifying your Medicare benefits. So let's get started. What is a Medicare Advantage plan? So Medicare Advantage is simply an alternative to Medicare. In one of my videos, I want to remind you, you have two choices. You can stay with the original Medicare, or you can go to Medicare Advantage, Part C of Medicare. So in this video, I'm going over Part C. It's an alternative to Medicare, and it's run by private companies, all right? Remember, it includes all your A and B, and can include your prescription drugs, your Part D benefits. There are several types of plans. HMO, PPO. Insurance companies love to use abbreviated, okay? So these are three of the most popular or the most commonly used plans in the country. Let's start with HMO. HMO uses networks. Has rules, right? Rules like referral and prior authorization, meaning, let's say you need a surgery, a simple surgery. Your primary care doctor, that your HMO provider, has to send the referral to the specialist and say, Albert Robledo needs a gallbladder surgery. The insurance company approves it. That's the prior authorization. The referral goes to the specialist and my surgery is done. If my primary care says, Albert, it's time for his colonoscopy or prostate exam, this is what he does. He sends that referral to the specialist, the urologist, or whatever doctor is needed, and then it's authorized, and now you get your services performed. That's how an HMO works. There's networks and there's rules. So it's important that you remember these key terms for the HMO model. Now, this primary care doctor is your gatekeeper. They're in charge of your care. Doesn't matter if you're in Georgia, Texas, Florida. Most insurance companies, HMOs, run the same way. They manage your care. They're in charge of you, and they will send out the referral to your specialist when needed, okay? So please remember, there's rules. What happens in an emergency situation? 911, life or death, what happens? Well, you pick up the phone, they call, the loved ones they take you to the ER. Is there time to call and check the directory and see, is this covered? Or is this ambulance service covered? Or is the hospital they're taking me covered? So in this case, under HMOs, in emergency situations, they're always going to cover you. It doesn't matter where you go. There is one big advantage on the HMO. They may even cover you under emergency situations in foreign countries. That's a big advantage. So if you're traveling to Mexico or Venezuela or wherever you're visiting and you have a heart attack, I have clients, I personally know people that what they do is they pay their bills in the country, they bring them back, they submit the claim to the carrier, and they get reimbursed. There's a limit of what you can get reimbursed. Don't forget, there is a limit, but HMOs will cover under emergency situations. That's basically HMOs in a nutshell. primary care doctor refers to the specialist. Primary care doctor is your gatekeeper, your specialist. If you need any kind of surgery, any kind of checkup, anything, you're going to need a referral or authorization, and in emergency care, you're taken care of. Let's go over a PPO. PPO situation. You have 2 columns in your books. Let's say you're a part of Bravo company or Delta company, and a PPO is going to have 2 columns, in network and out of network. In an HMO, there's only 1 column, in. If you go out, it's only for emergency situation, but PPOs have 2 columns, in and out. You pay lower copays if your doctor is in the network. But the big advantage of a PPO is this. Well, if you say, like, let's say you're in Texas and you want to go from South Texas to Houston, Texas, and the situation, the specialist you want to see is out of network. Well, guess what? You're still covered. You're still going to be seen. What's the main difference? The copay will be a little higher, the amount you spend. But the advantage of a PPO is you can go in and out of network. In network, lower copays. Out of network, higher copays. But the advantage is you can be seen. When my father got Medicare for disability, he was under the age of 65. I started him on a PPO. He was going through cancer in San Antonio, Texas. And so because of that, I decided I needed him to get care no matter what. And it didn't matter to me if it was out of network or in network. So me understanding insurance, this is what I would do. While we were in the cancer centers, they would say, okay, your dad needs this kind of procedure for tomorrow. So as a client, as a participating member with my father, I would call the company and say, hey, Mr. Company, my dad has this. Do you see the authorization? They're sending a referral. They're asking for authorization. Do you see it? Yes, we see it, Mr. Roberto. Okay. And then I would call back later. Is it authorized already? Yes, it's authorized. Since I understand insurance, I would go that far ahead so that my parents would get in and out of network coverage on the spot. And that's the biggest advantage of the PPO. I highly recommend them. Which one has lower copays? The HMO does. But remember, the HMO has lower copays. That's good, but it restricts you to certain areas. So if you live in San Antonio, Texas, your doctors you may be only be able to be seen in San Antonio. You can't go to Dallas or Houston, for example. So please remember, PPOs, in and out of network, big advantage. Special needs plans. A lot of the insurance company, Bravo company, Delta company, Charlie company, they have plans for, let's say, a diabetic. They may have plans for people that have Medicare and Medicaid. So if that's the case, there are plans for you. If you're a diabetic, Charlie company may say, hey, you know what? It's already June and you can't make a change, but you're a diabetic. We have this chronic plan and you can join it. You have Medicare and Medicaid and you just got Medicare and Medicaid. You can join this plan. So special needs plans are out there because there's a huge population in our country that do have special needs. And if you fall into those categories, you can qualify for a different kind of plan that may serve that special need even more. So if you have questions about this, can I qualify for a special need plans? Which ones are available to me? Call me, 956-622-8740. I'm here to help you. I want to make sense of all of these videos that you're watching. I want to make sense out of them for you. All right, so I'm going to continue. What are the different costs? I've already mentioned HMOs have lower costs than PPOs. Now, emergency care and urgent care, no matter which kind of plan you join, you're always going to be covered. Now, there are extra benefits for Medicare plans, Medicare Advantage plans. These different plans do cover, if you saw my last video, they will cover things like eyewear, dental care. They will cover, hearing. So these companies will cover things that Medicare does not cover. So this is an important thing. If you need some dental cleaning, there may be a plan for you. If you're a dual member, you have Medicare and Medicaid, they give you a lot of these different benefits. I want you to remember one thing though. The most important thing about you is your health care. That's number one, your health, then your then you remember all the extras that they give you, use them. They're there for you to use. I will tell you this, many clients do not use them. So please take advantage of the benefits the insurance companies are giving you. All right, now, last but not least, to join and to switch. Remember, every year there's an annual enrollment period between October and December. You can sign up for a new plan and your coverage starts in January. January through March, if you made a mistake or something happened, the doctor say, I'm not gonna take the plan, and you didn't change, well then guess what? You can make a change during the open enrollment period, January through March. If you lose Medicaid, if you gain Medicaid, if you drop employer coverage, you have special open windows to join a plan. So there's always different times that can help you. If you have a chronic condition, like I mentioned earlier, you may be able to join a plan. So please keep in touch with me. I can help you figure out this. I can help you figure out all of this. I wanted to say mess, but I'm trying to make it easy. So I don't want to use that word, but I'm trying to make this easy for you. Now, what am I gonna do? What are we gonna do together? We're gonna compare. I'm gonna compare. I wanna make sure your prescriptions costs are the lowest we can find out there. Which pharmacy will give you the lowest cost? Which carrier will give you the lowest cost? Are my doctors covered? So all of these things, what are we gonna do? We're gonna compare it and make sure you're taken care of. And I want to remind you of one thing. You always have special rights and protections. If something happens and you don't like the decision that was given to you by the company, you and your doctor can file appeals, grievances, so that you can get the results you were looking for. That has to be done with you and your doctor. Okay, that's very important to remember, but you always have rights and protections as a Medicare client. All right, so let's review. You have HMO, PPO, special needs plans. You have in and out of network. You have rules, which is networks. You have referrals and prior authorizations. You have to compare your drugs and your doctors and the costs. You get extra benefits. All of these things is what comes in a Medicare Advantage Plan, Part C of Medicare. If you have questions, call me, 956-622-8740. I'm here to serve you. Remember, my name is Alberto. My series is called the Medicare series, Aprendiendo con Alberto. Share my videos, share my content. I'm here to serve the community. Thank you very much for your time. I look forward to seeing you at the next one. Take care.